Good morning.
Good morning.
It's a real pleasure for me to be hosting this workshop today, the first of its kind on the UMB campus, and I'm really proud of the work we have all done to bring this to fruition. This workshop, of course, it's a interdisciplinary strategies for managing maternal opioid use disorder. I am Doris Titus Glover. I'm an assistant professor at the UMB School of Nursing. I'm based in Shady Grove. Thank you for taking the time out of your busy schedules to visit with us today. And we certainly appreciate that there are 1,000 other things that you could have been doing, but you're here with us today because this is a really important topic. The challenge of maternal opioid use management and treatment is one that is, captures our imagination. It is about individual well-being, it's about health, it's about safety, psychosocial events, medical treatment, access to care, legal implications, societal responsibilities, and the list goes on, and mostly not just for the mother and the infant, but for everyone else. A pregnant woman who's diagnosed with opioid use disorder faces a myriad of complex medical, legal, and psychosocial issues which are very challenging for any one provider or discipline to undertake. So these issues are not the responsibility of any one health provider, and we've come to realize that. Even as we recognize the intersection of disciplines and services and the different components and systems that are needed to manage and optimize the care for pregnant women, we still need to ask ourselves, how do we meet these needs and do what works best for the pregnant woman? The pregnancy is just the vehicle by which we as healthcare professionals can learn how best to manage women of reproductive age. Pregnancy is an opportune time for mitigating the harmful effects of maternal opioid use. Opioid use disorder in pregnant women contributes to maternal and neonatal morbidity and mortality. Today you will hear our wonderful presenters share strategies, lessons learned, and insights in the role of the intersecting patient, provider, and health systems interventions to guide comprehensive care for women. On behalf of the interdisciplinary team, which I will share in a minute, I welcome you to this eventful day. We hope you spend the day with us. In fact, you should plan on spending all day with us. This workshop is hosted under the umbrella of an interprofessional education project called Interdisciplinary Education Awareness for Maternal Opioid Use Disorder, which is funded by the UMB Interprofessional Education Center. Idea for Maternal Opioid Use Disorder, and I keep referring to it as MOUD, was structured as a collaboration with UMB disciplines that touch the lives of pregnant and parenting women. We established an initial interdisciplinary team from nursing and pharmacy, and expanded to medicine, law, and social work more recently. And we're very happy to have our team please stand up and be recognized. So we have Rebecca Vivret from nursing, Fadia Shaya from pharmacy, Catherine Fonili from nursing, Apuva from pharmacy, Michelle Taylor from pharmacy, and we have Jamie Switsolowski from nursing. We have Kathleen Hook from law school, and then Jay Unick from social work, and Rebecca Vivret from School of Medicine, and Dr. Welsh, Chris Welsh from School of Medicine as well. So you see we're very interdisciplinary and very diverse. Thank you to the team. Okay. With this endeavor, I cannot say how supportive the School of Nursing has been in achieving our goals so far. I would be remiss if I don't mention that this whole idea started when I was a postdoctoral fellowship at the Pharmaceutical Health Services Research Department under the mentorship of Dr. Shire. So I thank her for her continued support of the program. We would like to acknowledge our funders, the IPC Center at the School of Nursing. On your agenda, you have Dean Kershlin, who's unable to be with us today. So Dr. Mary Attamills, who's an acting dean of the School of Nursing, would be here to give us a few remarks. Thank you. Dr. Mary Etta Mills is a professor.
She's gonna read all this. Oh, no.
It's okay. Have a seat. We need to recognize the work that she's done. She's a professor in the Department of Organizational Systems and Adult Health and interim dean at the University of Maryland School of Nursing. She has previously served as Associate Dean for Academic Affairs at the University of Maryland School of Nursing and Vice President for Nursing at University of Maryland Medical Center. Her appointment as interim dean has been approved by Dr. J. Pearman, President of the University of Maryland, Baltimore. Dr. Mills' research, teaching, and professional activities have included extensive work in the fields of health services organization, quality of care, and patient safety, as well as development of the field of nursing informatics. Dr. Mills has led development of the first master's and first doctoral programs in nursing informatics in the world. Her interdisciplinary research and training grants totaling over $10.5 million have focused on developing the field of nursing informatics and on advancing the field of health services administration and education. She is well published, and please join me in applauding Dr. Mills and welcoming her to the podium.
Too much. Well, and all that's to say, I've been here for a long time, okay? So thank you, Doris. I really appreciate it. And all these photographs up here, you have a test, you'll have a post-test of identifying all these people. So take a good look at their pictures and try to place a name to them, okay? I really appreciate your welcome. It was far more than I expected. And as Dr. Titus Glover indicated, I am representing Dr. Jean Kirschling, who unfortunately can't be here today. She is caring for her husband, who's in home hospice care, and so she's on family medical leave. I am particularly happy, though, to be here for this introduction for your workshop on interdisciplinary strategies for managing maternal opioid use disorder. And this is such a timely and urgent discussion. I think that we were talking earlier about how the need is only growing. It's so inherent in the need to manage pregnant and parenting women with maternal opioid use. And it's a reminder of how much we need to have collaboration between the disciplines if we really hope to have any comprehensive approach to meeting the needs of these individuals and also trying to do something that will make a difference for the future for people who are not only having current problems, but for people who may be having problems longer term and who may be just getting introduced into a system that will only create difficulties for them and for our healthcare system as well. As Dr. Titus Glover said, the workshop is being hosted as an interdisciplinary team by the schools of pharmacy, medicine, nursing, social work, and law. And in addition, we're benefiting from the presence of many of our colleagues from the University of Maryland Medical Center. I think that something that's kind of obvious, but I still want to say it, the importance of interprofessional education is just critical. And UMB really has a great reputation for working through its 6 professional schools and the graduate school in doing a really outstanding job of promoting, and not only promoting, but in making interprofessionalism work in the fabric of what we do. We're very fortunate to be on a health science campus. There are very few of them across the country that have the kind of rich array of professional disciplines represented that we do. And so I think it's a unique opportunity and something that we just can't take for granted. We have such power and authentic commitment, and I think that collectively the states, this state and this school and this campus educate the majority of the state's physicians, graduate nurses, dentists, lawyers, social workers, and pharmacists. And a conference like this brings everyone together across disciplines and really holds the promise of breaking new ground in understanding the best evidence-based practices for caring for pregnant and parenting women with opioid use disorder, and then broadly sharing the knowledge. And I think that's really key. It's not only working together to develop and implement the knowledge, but in making sure that it gets disseminated across a much larger group of disciplines and across the country. We benefit from interprofessional education and practice. It really helps us to address complex issues through team-based approaches and bring the emphasis of multiple disciplines to bear on complex problem solving. I think this workshop is a great way of looking at how we can lead the way for others. The symposium holds a promise of providing a forum for cross-sector learning and sharing best practices and strategies. I'm so happy to see you all here today. I think your presence is an indication of not only how well I think the disciplines work together, but a promise of how we will be working together and expanding those efforts in the future. I know the sessions are all going to be stimulating. I know the conversations will engender a lot of discussions to help inform your work in the weeks and years to come. And I think that the insights that you'll gain from this conference will really help chart the course for future improvements in clinical care and better support for some of our most vulnerable and at-risk patients. I really appreciate your being here. We're so glad that you're all participating. I look forward to hearing what comes out of the conference and to hearing about the discussions and the directions that you choose to take as a result of the conference. I think it's really extraordinary, and I think it's something that we want to just keep developing over time as not only this particular conference, but other conferences that share our unique disciplines and blend them together in an interprofessional way that really can make a difference for what happens in population-based care and for these at-risk patients across lots of interdisciplinary challenges. Thank you very much.